guys, and welcome back to my channel. You will notice that I am wearing the exact same t-shirt as I was in my last video because I am filming these videos on the same day. Still have my trusty pad with me because I wanted today's video to be about medication and antidepressants. I personally, I'll tell you my story with medication first before I kind of go into it. So I've tried 4 medications and I've just been prescribed another one. So when I first went to my GP, I got prescribed sertraline because I explained about my depression and anxiety, and sertraline is known to be really good for anxiety as well as depression. So I was prescribed sertraline, 50 milligrams to start with. Took it for a few weeks. The side effects weren't great, to be honest. I mean, the first couple of weeks, your GP will sort of tell you this if you've never had antidepressants before, but the first 2 weeks of a medication are always the hardest. The first 2 weeks are where you get sort of all the side effects, but obviously if after 2 weeks they haven't worn off, then go back to your GP. And for me, they didn't wear off. I don't know if my body doesn't react well to antidepressants, but they just don't agree with me, in all honesty. But sertraline 50 didn't work. I just felt very tired, very groggy, and they made me feel really shit, in all honesty. I went back to my GP. I said, look, they're not working, and I still have side effects. He said, well, I don't want to put you on something else so quickly because you've not been on this that long. Let's put it up to 100, and if it works for your mental health but the side effects are still there, I can give you something for the side effects. If it's still not working for your mental health, then we'll move on to something else. So I went away with a 100 milligram prescription this time. So I took that again for a while. They always say to give it about 6 weeks on a medication. So I gave the first dose 6 weeks, which is the average time for you to actually first start to notice it working. It takes about 4 to 6 weeks, which is a bit of a pain when you've got 2 weeks of side effects and then you've got to wait 6 weeks for it to work. And then obviously if after 6 weeks you've got no benefit, then you've got to sort of do the cycle again, which is, I think, the frustrating part for people. But I took 100, did it again for a while. I think, in all honesty, I was on sertraline for about 4 months, and it just didn't work. The side effects were still quite significant, and my mental health didn't feel any different. So they said they would try something different. So I then went on to venlafaxine, which is a completely different type of antidepressant, which I'll go on to later on. But I took venlafaxine, 75 milligrams, and that one did not agree with me at all. With that one, I constantly felt nauseous. I couldn't eat. It actually didn't physically make me vomit a few times. My body obviously just didn't react with it very well. I was only on that, I think, about 3 or 4 weeks. I went back to my GP. I was like, look, I'm vomiting all the time. I can't eat a meal. I didn't eat a full meal in those 3 weeks. I didn't eat a proper meal in that time. And she was like, look, we'll just change it. So I weaned off venlafaxine and I was put on citalopram 20. Again, I got the same sort of side effects as sertraline. So sertraline and citalopram are the same type of antidepressant, and I just got all the same side effects, and I just didn't find that one worked either. So I just kind of weaned myself off it, and by that point I'd got very disheartened with medication. I thought, I've tried 3 antidepressants, all 3 of them don't work. I didn't even bother going back to my GP at that point for a different medication or to up the citalopram. I'd kind of just given up on taking medication altogether. So but at the time that I got prescribed the citalopram, they gave me a form for self-help, which, we kind of refer yourself to therapy. So I did that, and I'd already had the call by this point from the self-help team, who advised obviously I needed therapy and that I would be put on the waiting list. So I thought, do you know what, medication evidently doesn't work for me. I'm on the waiting list for therapy. I will just manage until then, which evidently didn't work very well. So that was, I think, in about August this year. So I took the sertraline. I started taking the sertraline last December 2018, sorry, not 2019. And then obviously I tried all these things, and I stopped citalopram in August. And I hadn't taken anything since. That was until about a month ago when I went back to my GP, and I said, look, my anxiety is really bad. Please, can I have something for my anxiety? I was like, I've tried all these antidepressants, they don't work. What can I do? And they said, he asked me about my physical symptoms, so panic attacks and having like shortness of breath, heart palpitating, sweating, feeling sick, all the sort of physical symptoms of anxiety. So basically he prescribed me propranolol, 10 milligrams, and he said I could have 40 milligrams 4 times a day, which I think is quite a lot. But basically he was very clear in that this medication would not help what is going on in my head. This would just help with the physical symptoms, which is fine. So like when I was on the train, I would take one before I got on the train, and that sort of helped the anxiety, which was good. So it helped me to sort of manage my anxiety in that moment. It was sort of like taking diazepam as something to relax you. But I knew that sort of this medication wasn't going to help what was going on in my head, but it was useful as and when I sort of needed it. But then I went back to my GP last week, and this was just to get a sick note to stay off work because I'm not ready. And she's just prescribed me mirtazapine, which is another completely different antidepressant. I couldn't get it from the pharmacy, so I haven't actually started that medication yet. But obviously if people want to know if the mirtazapine works and how I'm coping with it, then I can sort of do updates. I can put it on my Instagram story, that kind of thing, if people are really interested in that one and my experiences with it. So I'm happy to do that at some point. But I just thought I'd go through the different types of medication, which ones you can be prescribed, the ways that they work, side effects, and sort of all that jazz. So the first ones I talked about was sertraline, which is an SSRI. So these are the most widely used antidepressant. These are the ones that you're most likely to get prescribed at the first point from your GP. So they work by changing the chemical imbalance in your brain in terms of noradrenaline and serotonin. SSRI basically stands for selective serotonin reuptake inhibitor. So they make serotonin more available in the brain by blocking the reuptake process, which is, they basically replace the neurotransmitter which fires in your brain. And these are widely used for depression and anxiety. These ones are known for helping with anxiety. So the most likely ones you'll get are sertraline, which I tried, citalopram, which I also tried, fluoxetine, and paroxetine. So they're the common ones, they're the main four. If, like me, they don't work, you move on to an SNRI, which are very similar, but they also affect noradrenaline as well as serotonin, which SSRIs only affect serotonin. Also noradrenaline is also one of the, so you've got serotonin, noradrenaline and dopamine, which are the 3 chemicals in your brain which affect mood and mental health. These are meant to be more effective than an SSRI, but the evidence doesn't suggest that there's no evidence to suggest that they are or not. And there's only really 2 main ones in terms of an SNRI. I've tried one of them, which was venlafaxine, which is obviously what I was given after sertraline didn't work. and the other one is duloxetine, which is quite a common one. But again, you know, everybody's body's different. It's a case of trial and error in a lot of cases. Most people won't find their antidepressant until they've maybe tried two or three. So it's just a case of finding out what works for you and your body. Not one thing is going to work for everybody, and that's the thing about mental health. Everybody's totally different, so you never know, you know, what works for other people doesn't necessarily work for me, and what works for me won't necessarily work for other people. The other one is a NASA, which is a noradrenaline and specific serotonergic antidepressant, which are effective if you can't take SSRIs or SNRIs, which is the situation that I'm currently in, and they are meant to have less side effects, although these ones are known for making you very sleepy and very drowsy. The only really main one that you'll be prescribed is mirtazapine, which is the one I've just been prescribed, and she said it will make me very drowsy and very sleepy. It's really good for people who suffer with insomnia, and you can sort of take it before bed to help you sleep. So obviously I'm not sure how well that one works, but like I said, I can always keep you updated on my progress with that. And then you've got two other antidepressants, but these are very, very, very rarely used anymore. So you've got tricyclic antidepressants, which are rarely used just because they've got a really high risk of overdose. So if you were to take these in an overdose, it's got quite significant effects, and it can be really fatal. And they are a lot older. These are like a much older antidepressant, which means they've got a hell of a lot more side effects. So you wouldn't really be prescribed these generally by a GP. The main one is like amitriptyline and nortriptyline. Amitriptyline is mainly used now for things like pain. It's generally not really used as an antidepressant anymore. And then you've got MAOIs, which are monoamine oxidase inhibitors. And again, these are rarely used just due to how significant the side effects are. Obviously, the newer antidepressants have got a lot less side effects. The two there that you might be prescribed are transcycloproamine and phenelzine. But like I said, very, 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 very rarely used these days. You're most likely going to get an SSRI or an SNRI, and if you're like me and your body's shit and doesn't like antidepressants, you might get mirtazapine. But I don't want people to get bogged down with antidepressants. Antidepressants for a lot of people are very useful. They help you get back to a normal level of functioning, which then allows you to deal with the issues that are going on, because obviously antidepressants don't cure you. They only sort of mask the symptoms to get you up, get you out of bed, get you to a normal level of functioning, and then you can kind of deal with the problems from that. But they don't actually deal with the symptoms, which is, I guess, what people don't like. So, they're not your only option. If you find them useful, then wonderful. A lot of people do, and some people function really well by taking an antidepressant every day. Whether mirtazapine will finally work for me, I don't know. But there's loads of other options. I know the waiting list for therapy is completely ridiculous. I've been on it 6 months and I can't see me getting, I don't see me getting close anytime soon. But most people use them in conjunction, and obviously you can use them with things that you do at home, like I said, meditation, mindfulness, and there's loads of stuff I'm going to cover in future videos in terms of what you can do at home to help yourself. But just be aware of side effects of antidepressants. A lot of them can make you feel very dizzy, very tired, very drowsy, give you problems sleeping, make you feel nauseous or sick, headaches, diarrhea, vivid dreams, sexual problems. There's a real long list of side effects. So please, if you get an antidepressant, please look at the little piece of paper inside, look at the side effects, and just make yourself aware. You don't want to be making yourself more ill, because actually if you read the side effects, a lot of them things like sertraline in particular can actually make you feel very suicidal in the first couple of weeks. Can actually make your mental health a little bit worse for the first couple of weeks, can give you more anxiety. So please check the side effects of each medication, because those first 2 weeks, like I said, are very difficult. And if you don't know that it's the medication that's causing your heightened problems, it can cause some confusion, and that, you know, it could cause you a lot of problems. Some people have taken their own life in the first 2 weeks of a medication. So please be aware about what you're taking, what side effects it can cause, and just be mindful, I guess. And like I said, if after the first 2 weeks the side effects are still there, please go back to your GP and explain what's going on. And please do not just stop a medication. Antidepressants are known for having really bad withdrawal symptoms. So if you've started a medication, you're not feeling it, it's not working, just go back to your GP, tell them it's not working, and they will give you a plan to wean off that one and maybe start another one. But do not just get up one morning and think, I don't want to take this anymore, and stop it dead, because that can cause you more problems than actually just continuing to take it until you see your GP. So I think I've kind of covered a lot of bases there. Obviously, if, like me, you want more medication for anxiety, you can go down that route, looking at even some painkillers can really help for anxiety, like some beta blockers, propranolol, which is what I'm taking, and there's a list of anxiety medication which you can ask for. Things like benzodiazepines like diazepam and lorazepam are very rarely you're going to get prescribed unless you're in sort of a secure mental health hospital. But like I said, any issues, just go back to your GP. Any problems with them, that's your best point of call. Don't go googling it, or like I said, or stopping the medication if you're having bad side effects. So, because sometimes it can be worse to just stop it. I hope that's being helpful for some people. I know there can be a lot of confusion around antidepressants. Are they worth it? That's the question I get asked quite a lot. Is it worth taking an antidepressant? Well, only you know. Everybody's body's different. For me, I've managed for quite a long time without them, and I haven't found any useful. Some people, they work really well. I know a lot of people that they work really well for. So it's trial and error. It's your body. You are completely different. You are unique. It's going to work differently for you than it is for anybody else. Don't listen to people's scare stories, or I took this and it made me do this, or this happened. That's not necessarily going to happen to you. And like I said, any issues, there's loads of places. If you really are in a bad place, go to A&E. There's things you can do if you really are struggling. But giving them a go. You are likely going to be prescribed them if you go to your GP talking about your symptoms. If you don't want to take one, that's completely fine. If that's your choice, then that's up to you. I tried them. I thought they might work, and they didn't. But don't take my story as well. She's tried 4 or 5 medications and they haven't worked. My body is totally different to yours. So don't worry about it. Give them a go. If they don't work, you can go back to your GP, try something else, and hopefully you will find one that works for you. But like I said, I'm no guru. I just thought I would make a video, pass on the information that I know of. It might encourage someone maybe to go and get some antidepressants, or change their antidepressant, or even question the side effects that you're suffering with. So I hope that video has been useful for some people. I'm just, for this channel, I'm trying to make content that I think I would have found useful at one time. I never had anybody to kind of speak to me about medication, speak to me about my options and my choices, the things I might face while taking antidepressants, and actually that it's just complete trial and error, and I might not get it right first time, maybe not even second or third time. So sometimes just having that knowledge makes the process a hell of a lot easier. So I hope if you're going through that process at the moment that this has been useful in any way. Like I said, I say at the end of every video, all my social media is linked down below, so if you have any questions whatsoever, feel free to send me a message, DM me on social media, or even leave me a comment, anything. I'll be happy to help. As much as, you know, I struggle with mental health as you know, like day-to-day life, I do also have a degree in mental health nursing, so I have both sides. I have that personal experience and also my professional experience, which hopefully might be useful for some people. So my inbox is open to anybody who wants to send me a message. If you've got any questions or concerns, I'm more than happy to answer them. So just check the description box for all my social media. And I'm going to now wrap up this video before I ramble on anymore. Like I said, if you've enjoyed it, leave me a like, comment, subscribe to my channel if this is the kind of content that you want to see. It's been going well so far, which is really amazing. I feel very overwhelmed by the whole experience and the support. So thank you very much for watching. I really appreciate it. And I guess I will see you in my next video. Thank you. Bye.